The thymus is the master gland of the immune system. So in that diagram, you see this yellow glowing ball between the heart and the neck. So the thymus is this pinkish, grayish blob of tissue inside your chest. It's inside your chest cavity. And it is the master gland of the immune system. So it manufactures these T cells that you've been hearing about so much. It also takes care of those T cells by producing hormones. And T cells, as you've already heard, fortunately, are the cells in your body that go out and like to kill infections. And now, as we heard from Ray Kurzweil, they're learning how to kill cancer as well, better than they used to. Although in youth, you may get cancer all the time and kill it and not know it because you have good T cells and other cells that can kill cancer. And as you just heard, the T cells also talk to and regulate the B cells, which make antibodies. So the T cells are really the center of what has been referred to previously as the adaptive immune system. That's actually the more complicated, more powerful part of the immune system. And you've heard a bit about the innate immune system, natural killer cells. We're talking about the adaptive immune system because that's the part of the immune system that's most strongly affected by aging. Okay, so the thymus makes the T cells that control most everything that's really super important. And the problem with aging is that your thymus stops working. That's not good. Because when the thymus stops working, you get immunosenescence. So this is what immunosenescence really means. So what we're graphing here is the sum total of all foreign invaders that your body is able to recognize as foreign and kill. Bacteria, viruses, cancer antigens, whatever. And as you can see, people didn't really take thymic involution, or the problem of the thymus, very seriously, because if you make measurements of the repertoire, the sum total of things you can kill off that want to kill you, it doesn't change much out to the age of about 62. But if you actually look at older people, then you find that your immune system literally falls off a cliff. You lose 98% of your ability to recognize things that want to kill you. This is not good. And this is both in the naive cell compartment, you know, the new cells your thymus just made to marshal the army to fight off these foreign invaders, or cells that have been around a while that know how to attack things. You lose both of them, 98%. Losing 98% of your immune system causes you to die. Without an immune system, we get sick. According to the Center for Disease Control, it's been estimated that 90% of flu-related deaths take place in people who are 65 years of age or older, and 60% of all hospitalizations are in that same group. And I just showed you that that is in the age range in which your immune system collapses, which you lose 98% of your ability to fight off things that want to kill you. So what is our concept? So Jack LaLanne is kind of a good example of our thinking about this. So Jack LaLanne, for those of you who are my age or a little bit younger, you may remember Jack on television doing jumping jacks and skipping rope and everything, flexing his muscles, lifting weights, and preaching to everybody how good it would be to be physically fit. And he was right. He practiced good nutrition, clean living. He made it to the age of 96 in great shape. But guess what he died of? He died of pneumonia, an infectious disease, immunosenescence, because you can't protect your thymus, you can't protect your immune system by flexing your muscles. Okay, so we have to do something about this. So what is the problem? The problem is thymic involution. So this is a very unique situation for us thinking about aging. We all think about aging as something that happens when we get older. No, in this case, aging is programmed in youth. So as you go through puberty, okay, so I got a cartoon of the thymus on the left showing the different regions, the medulla and the cortex. And also in that left cartoon, you see that the lower two cross-sections through the thymus are becoming more and more yellow. Yellow is fat. So you need the functional cells in the thymus to do all the good things the thymus does. We don't need a bunch of fat in your thymus, but that's what happens. So up in the upper right diagram, you see that the proportions of cortex and medulla go down as you get older, namely as you get to be more than about 12 years old, and the proportion of fat increases. So that by the time you're out to maybe 40 years of age, you have practically no thymus mass left that you can detect. This is really bad. This is not good. And as you can see in the other diagram, Thymus-related immunity, which is the top curve, falls off the cliff between 60 and 80, as I told you before, just as your mortality rate from aging is really starting to skyrocket. And I can't really believe that that's a total coincidence. So, what can we do about this? Well, unfortunately, as Bill Falloon is going to tell you about more in detail, and as you just heard a little bit about from Dr. Kiproff, young plasma transfusions or heterochronic parabiosis in some form or the other, in terms of providing young plasma factors to reverse aging, is a fantastically powerful, fantastically exciting area, which is going to reverse a lot of aging. But it's not going to reverse this part of aging. Why? Because thymic involution is programmed when you're young. So if you take any young person's plasma or youth factors and you put them into an older person, it's not going to work. As a matter of fact, heterochronic parabiosis has been tried for this and it failed. So that's not the answer. But there is an answer. That's the good part. There is an answer. There's a fantastic answer. It's practical. It's something we can do right now. It's something that we're doing human clinical trial on right now. And even better, you can do this in humans. You can do this in people. So what you're seeing across the top of the screen is a CT scan of an AIDS patient before and after basically the same treatment that was given to the rat and to the dog. And the arrows point out that before treatment, that area between the breastbone at the top of the cross-section through the human and the aortas and stuff in the chest, you don't see much. There's not much there. But after about a year of treatment, the arrow shows this ghost-like figure down there. That's your thymus. It's come back. Okay, so that's an AIDS patient. AIDS patients' thymuses are a little funky. So I was sort of upset because nobody bothered to try this in normal people. And I tried to get people interested. Nobody was interested, so I did the experiment myself on myself. So this is a series of photographs that was published. Thanks. Thanks. Okay, so growing a thymus is nice, but it better do something. It has to work. It's not just cosmetics that we're talking about. It's got to restore your immune system. Well, it does. That's the good news. It does. So this is a study. Again, this is an AIDS patient. So in AIDS patients, the HIV virus is eating up the immune system as fast as you're regenerating it practically, but you can still regenerate it. So these are new T cells coming out of the thymus. 3 different measurements of these new T cells. Those are naive CD8 cells, naive CD4 and CD8 cells, and a more general category on the left. It all shows the same thing, that you can restore immune system even in people who are being eaten alive by the AIDS virus. Okay, so how does it work? What is this magic treatment? Well, actually, the core of it is pretty simple, although simple is a relative word. The key medication is human growth hormone. Human growth hormone regenerates the thymus, it restores immunity, and it has other interesting effects, which I'm going to describe to you later as well. But human growth hormone by itself is not enough because it has side effects and there are risks. So our trial is heavily focused on de-risking the use of this, so you can do all of this safely. And so one of the components of that is to use a unique HGH treatment procedure and a strategy to regenerate your thymus that minimizes risk. But then on top of that, we're giving specific blockers of the side effects of growth hormone. So one of the ones that we focused on particularly is insulin. So when you're young and you have tons of growth hormone coursing through your body, your insulin is fine, no problem. But if you're older and you have growth hormone given to you, your insulin starts to go through the moon in many cases. And why is that? So I reason that it may be because when you're young, you also have tons of DHEA. It's a natural hormone made by your adrenal gland, coursing through your bloodstream madly, but declines dramatically as you get older. So I experimented with combining growth hormone and DHEA, and as you can see, it completely reversed the effect of growth hormone and insulin. This is really important because increasing insulin is a very pro-aging effect. It's really something you don't want to do. The antidotes to growth hormone toxic effects also independently lower all-cause mortality in animals and humans. So it's good to be able to counteract side effects with things that have good effects on their own. So where are we now? As I indicated, we're 10 months into the trial so far for cohort 1, 5 months in for cohort 2. Subjectively, everybody loves it. You know, they feel sharper, they feel sexier, they feel invigorated. Their mood is high for the most part. Some of them are a little cranky, but mostly they've got a good mood. And we have preliminary evidence that the thymus is regenerating even in as little as 5 months on the treatment. Unfortunately, I don't have that data available to show to you right now, but what I do have is an illustration how we can tell that. So this shows sort of the way that we triangulate the thymus. So this is cross-section, you can see on the left, cross-section through the human chest, 3 different directions, this way, and whatever, that way. And you can use that to build up a 3-dimensional image of the thymus. So we've made the thymus colored in the central panels here. And then on the right, you can see this 3-dimensional reconstruction of the thymus. So we can measure the volume of the thymus, but we can do more than that. We can look at the functional mass versus the fat mass, because that's really what we want to improve. Okay, so I'm going to bring up a more general thing with you now in the few minutes we have left. So you know what we're trying to do, but what we're trying to do has much broader implications than what we were originally sort of shooting for, because growth hormone does more than regenerate the thymus. It also regenerates your spleen. It regenerates your muscle. It regenerates your liver. It regenerates your lean body mass. It regenerates your skin. Your skin becomes thicker. You look better. It also burns off a lot of fat, which accumulates with normal aging. So you see all of that in the left side of this image here, whereas these things just continue to go south as you age normally. So this is actually a body-wide anti-aging effect. You know, as you get older, you become, you know, the little old lady syndrome. You get smaller. Your organs are shrinking. Obviously, you can't shrink down to 0 or you're not there anymore. So if we can reverse that, that's a really good thing. Let's take this a little deeper. Now, this is really particularly amazing, and I've been very impressed by this, and everyone else has ignored it as usual, but here's the story. These are really important aspects of aging that seem at first glance have nothing to do with the immune system. But if you give an old animal a thymus transplant and look at what happens to these other parameters of aging, they all go back to what happens in a young control animal. So all of these parameters are graphed as a percentage of the young normal value. So 100% is that gray line going up on the left side of the screen. And so, for example, if you give a drug that causes a gland under your jaw to synthesize DNA, well, that response goes down by 70% with aging. But with the thymus transplant, it comes completely back. You become hypothyroid. That's reversed. Your brain cell ability to communicate to each other goes down 50%, completely reversed by a thymus transplant. Your insulin levels go up, normalized by a thymus transplant of all things. The last one is a little complicated, but it's also normalized. And since I'm seeing I have 1 minute, let's just keep moving right along. Okay, so I don't really have time to explain this the way I intended to, but what you're seeing is a longevity curve, mortality curve. So the heavy black line is the death pattern of a normal population of mice. And if you give the mice 5 thymus transplants serially, it staves off death. So you can see the median lifespan is greatly extended. The thymus does more than just give you an immune system. It normally, as you've heard, doesn't attack you, okay? And when it attacks yourself, then that's autoimmunity. And so the reason the thymus can avoid attacking you and it can attack everything else that's not you is because it can distinguish you from non-you. It can distinguish self from non-self. But if we regenerate your thymus, and you now have a thymus where you really didn't have one before, there's ways that you can trick the thymus into doing your bidding. So now you can redefine an organ transplant that you need to be self. And you can receive that organ transplant with no rejection and no need for immunosuppression for the rest of your life. There's 80 different autoimmune disorders, but you can fool the body into remembering that you is really you, you know. So with autoimmunity, it thinks that you are something other than you, but you can use the same trick for the organ transplant to reteach the body that you are actually you and stop attacking yourself. So we are looking to start clinical trials to cure type 1 diabetes, multiple sclerosis, lupus, whatever. Thanks. And in 2013, Science Magazine named cancer immunotherapy the breakthrough of the year. And last Saturday in the New York Times, there's a big headline, again on the same thing, harnessing the immune system to fight cancer. And they're talking about using a patient's own immune cells to teach those immune cells how to kill off cancer. But the only point I would make is if you want that to work, you have to have an immune system. So we're going to make sure that you have one. Okay, so the conclusion is we believe that the prevention and reversal of immunosenescence is possible right now. And we believe that we can do this in a way that's practical and safe. And beyond that, we believe that this approach has a general aging reversal effect, which we can, again, implement right now. And, of course, if we can prevent transplant rejection and reverse autoimmune disorders and give you an edge against cancer, that's all to the good as well. So thanks for your attention.